When urea is found to be excess in your blood, it means that the kidneys are not working properly, since they ought to remove the waste. The other thing is that if the electrolytes, largely potassium ions and sodium ions, are found to be in a deranged form, it means that the kidneys are not working as they should be, since they ought to control the electrolytes. Sometimes if you have an electrolyte imbalance, it could lead to an instantaneous death. Also, the kidneys ought to remove what we call creatinine, a product that is produced when your muscles are active. And if it is found to be in excess, it means that the kidneys are not working properly. Sometimes these tests could be misleading. That is, you could have a false positive result. Maybe you have been working lately very hard, especially maybe in the gym or doing hard labor. So sometimes it could lead to a false negative result. The other test that could be of help is an ultrasound test. It can show whether the kidneys are swollen, maybe due to a condition called hydronephrosis, due to back pressures of water that is brought about by blockage of the urine flow, maybe by the kidney stones or an infection. It could also show the kidney stones, and it could also show whether you have an inflamed bladder due to an infection. The other test that could come in handy is a total blood count test, also called the full hemogram, whereby we shall be looking at the quantity or the level of the red blood cells, since the kidneys also help in the manufacture or the synthesis of the red blood cells. Remember, there are other many reasons, especially they could be obstetrics or gynecological, whereby we have heavy bleeding, especially when we are having a patient with miscarriage, which could be spontaneous or procured. Excess bleeding could also lead to kidney failure. We have had instances whereby a patient bled a lot at home, and they did not seek treatment early, and when they collapse and they are resuscitated at the hospital, they only wake up to find that their kidneys have failed. So for even the expectant mothers who have had a history of heavy bleeding during delivery, it is good that they seek help, or they seek treatment, or they deliver at a main hospital whereby transfusion can be done. So that's much about the kidney and how we should look after our kidneys. And until next time,